Welcome and thank you for joining this presentation of the Community Assessment Process for Zip Code 75503 in Texarkana, Texas. This assessment was completed using the Centers for Disease Control and Prevention's Community Health Assessment and Group Evaluation, or CHANGE, framework. The purpose of this presentation is to share the assessment process, key findings, identified community needs, and recommended action plans for improving community health outcomes. This community assessment focused on zip code 75503 in Texarkana, Texas, and utilized the CDC Change Framework to evaluate community health needs and resources. The purpose of this assessment was to identify community strengths, assets, and priority health concerns affecting residents. Findings from the assessment were used to develop evidence-based action plans designed to improve population health outcomes and quality of life. The CDC Change Framework was selected because it provides a structured process for evaluating multiple sectors within a community and identifying policy, systems, and environmental factors that influence health outcomes. A community assessment is a systematic process used to collect and analyze information about a population to better understand community strengths, resources, challenges, and health needs. Evaluation is the process of examining findings and determining how they can be used to improve future programs, policies, and interventions. Conducting a community assessment provides several important benefits. First, it helps identify the most pressing health concerns affecting residents. Second, it allows stakeholders to make informed decisions based on data rather than assumptions. Third, it supports the effective allocation of community resources and funding. And finally, it encourages collaboration among community organizations, healthcare providers, educational institutions, and local leaders. For this assessment, evaluation findings were used to prioritize community health needs and develop practical action plans that address identified concerns within zip code 75503. The assessment process also provided valuable information regarding community strengths that can be leveraged to support future health improvement efforts. The Community Health Assessment and Group Evaluation or CHANGE tool was developed by the Centers for Disease Control and Prevention to help communities assess their current health environment and identify opportunities for improvement. The CHANGE process guides communities through a structured assessment that examines factors influencing health outcomes across multiple sectors. Rather than focusing solely on individual behaviors, the framework evaluates policies, systems, and environmental conditions that affect health and quality of life. The change process provides communities with a snapshot of their current strengths, resources, and needs. It also helps identify areas where improvements can be made to support healthier lifestyles and reduce health disparities. For this assessment, the change framework was used to evaluate conditions within zip code 75503 in Texarkana, Texas. The information collected helped identify priority community health concerns and inform the development of action plans designed to improve long-term health outcomes for residents. The change process also allows communities to track progress over time, ensuring that future improvements and interventions can be measured and evaluated effectively. The CDC Change Framework provides several important benefits for communities seeking to improve population health outcomes. One of the greatest benefits is stakeholder collaboration. The change process encourages community leaders, healthcare organizations, educational institutions, businesses, and residents to work together to identify community priorities and develop solutions. Another benefit is the identification of both community assets and needs. And while assessments often focus on problems, the change framework also highlights strengths and existing resources that can support future improvement efforts. Change supports evidence-based decision-making by using data to identify priority concerns rather than relying on assumptions. This helps communities allocate resources more effectively and focus efforts where they can have the greatest impact. The framework also emphasizes policy, systems, and environmental changes that can create long-term improvements in community health. These changes often have a broader and more sustainable impact than individual level interventions alone. And finally, the change process provides a strong foundation for developing community action plans that address identified needs and support healthier communities over time. For zip code 75503, the change assessment helped identify priority concerns related to economic instability and physical inactivity, while also recognizing important community assets that can be leveraged to support future health improvement efforts. The CDC Change Framework evaluates health-related conditions across 5 community sectors. Examining multiple sectors provides a comprehensive understanding of the factors that influence health outcomes within a community. The community at large sector focuses on policies, resources, and environmental conditions that affect residents throughout the community. The community institution and organization sector examines organizations that provide services and support to residents. The healthcare sector evaluates access to healthcare services and community health resources. The school sector assesses educational settings and opportunities that influence health. And finally, the worksite sector considers workplace environments and wellness opportunities. Multiple data collection methods were used during this assessment. Community observation was conducted to evaluate neighborhood conditions, recreational opportunities, walkability, and environmental factors affecting health. Secondary data sources, including demographic, socioeconomic, and health-related information, were obtained from the U.S. Census Bureau, Texas Education Agency, SparkMap, and other credible public data sources. The assessment process occurred over several months as information was gathered, analyzed, and interpreted. Using multiple sources of data improved the credibility of findings and provided a more complete picture of community strengths, assets, and needs. The information collected through the change process ultimately guided the identification of priority health concerns and informed the development of community action plans for zip code 75503. A successful community assessment requires collaboration among stakeholders who represent various sectors of the community. Stakeholders provide valuable insight into community strengths, challenges, available resources, and opportunities for improvement. The City of Texarkana was identified as a key stakeholder because local government plays an important role in policy development, infrastructure improvements, and community planning efforts. Christus St. Michael Health System was selected because healthcare organizations provide critical services, health education, and community outreach programs that influence population health outcomes. Texarkana Independent School District and Texas A&M University Texarkana were included because educational institutions play an important role in health promotion, workforce development, and community engagement. Workforce Solutions Northeast Texas was identified as a stakeholder because of its role in employment services, workforce development, and economic stability initiatives. The Parks and Recreation Department was included because access to recreational opportunities and safe spaces for physical activity directly impacts community wellness and quality of life. And finally, community residents remain the most important stakeholders because they are directly affected by community conditions and will ultimately benefit from successful implementation of recommended action plans. Together, these stakeholders can support future planning, implementation, and evaluation efforts at improving health outcomes within zip code 75503. Several data collection methods were used to gather information about zip code 75503 and evaluate community health needs. Community observation was an important component of the assessment process. Observations were conducted to evaluate neighborhood conditions, recreational facilities, walkability, accessibility, and other environmental factors that may influence health outcomes. Secondary data review was also utilized extensively. Information was obtained from credible sources, including the U.S. Census Bureau, SparkMap, Texas Education Agency, Workforce Solutions Northeast Texas, and other publicly available data sets. These sources provided valuable demographic, socioeconomic, educational, and health-related information. One of the greatest strengths of the assessment process was the use of multiple data sources. Combining community observations with demographic and health data helped create a more complete understanding of community conditions and strengthen the credibility of findings. The assessment successfully identified community assets, strengths, and priority needs while providing valuable information to support future planning efforts. Challenges included limited opportunities for primary data collection, such as focus groups, interviews, or community surveys. And additionally, some community level health data were not available specifically for zip code 75503 and required the use of county level or regional information. But despite these challenges, the assessment provided sufficient information to identify priority concerns and develop evidence-based action plans focused on improving community health outcomes. Community observation identified several strengths and opportunities for improvement related to physical activity and walkability. One significant community asset is Spring Lake Park. The park provides residents with access to walking trails, recreational facilities, open green space, and opportunities for physical activity. Community parks such as Spring Lake Park promote healthy lifestyles and provide safe spaces for exercise, recreation, and family engagement. And while recreational resources are available, observations also revealed opportunities for improvement. Sidewalk infrastructure is inconsistent throughout portions of the community. Some areas provide safe pedestrian access, while others lack connected sidewalks or walkable routes. Limited pedestrian infrastructure may discourage walking and other forms of physical activity. This finding aligns with one of the priority community needs identified during the assessment process: physical inactivity and limited walkability. Improving sidewalk connectivity and increasing opportunities for safe, active transportation could support healthier lifestyles and encourage greater participation in physical activity throughout the community. In addition to physical activity resources, the assessment identified several community assets related to healthcare, education, and economic development. Christus St. Michael Health System serves as a major healthcare resource within the community and provides residents with access to preventative services, treatment, education, and outreach programs. Texas A&M University Texarkana also serves as an important community asset by supporting educational attainment, workforce development, and community engagement. Additional organizations, such as Workforce Solutions Northeast Texas, provide employment services, job training opportunities, and resources that can help residents improve economic stability. And despite these strengths, asset findings identified economic instability as the highest priority community need. While the overall poverty rate within zip code 75503 is lower than many surrounding communities, vulnerable populations continue to experience barriers related to employment, education, transportation, and access to resources. The assessment also identified opportunities to improve awareness of existing community programs and strengthen workforce development initiatives. Increasing connections between residents and available resources may help reduce economic disparities and improve long-term health outcomes. These findings support the recommendation to implement an economic stability action plan focused on workforce development, education, and community resource awareness. The change assessment identified 5 priority community needs within zip code 75503. The highest priority need was economic instability and poverty. And although community demonstrates many strengths, assessment findings indicated that vulnerable populations continue to experience challenges related to employment opportunities, educational attainment, access to resources, and economic security. Economic conditions influence many aspects of health, including access to healthcare, transportation, nutritious foods, and overall quality of life. The second priority need identified was physical inactivity and limited walkability. Community observations revealed that while residents have access to parks and recreational facilities, sidewalk connectivity and pedestrian infrastructure are inconsistent throughout portions of the community. These environmental factors may create barriers to regular physical activity and healthy lifestyles. Additional community needs identified during the assessment included educational attainment disparities, nutrition and healthy lifestyle support, and tobacco prevention and wellness education. The assessment also identified numerous community assets that can support future improvement efforts. These assets include strong healthcare resources, educational institutions, parks and recreational facilities, workforce development programs, and engaged community stakeholders. Based on these findings, 2 action plans were developed to address the highest priority needs: economic instability and poverty, and physical inactivity and limited walkability. These action plans are designed to leverage existing community strengths while addressing identified gaps and barriers. And the final phase of the change process involves translating assessment findings into action. Based on the results of this assessment, 2 community action plans were developed to address the highest priority needs identified within zip code 75503. To guide implementation, a logic model was developed to illustrate the relationship between community resources, planned activities, expected outcomes, and desired outcomes. The logic model serves as a roadmap for how assessment findings can be transformed into measurable improvements in community health. The Economic Stability Action Plan focuses on increasing workforce development opportunities, improving awareness of community resources, and strengthening partnerships that support employment and educational advancement. These efforts are intended to improve economic security and reduce barriers that contribute to poor health outcomes. The Physical Activity and Walkability Action Plan focuses on increasing opportunities for physical activity, promoting community recreation programs, and advocating for improvements in pedestrian infrastructure. These efforts are intended to create a healthier environment that encourages active lifestyles and supports long-term wellness. Short-term next steps include sharing assessment findings with community stakeholders, increasing awareness of identified needs, establishing partnerships, and securing resources necessary for implementation. Long-term goals include improving economic stability, increasing physical activity participation, reducing health disparities, and enhancing overall quality of life for residents of zip code 75503. Successful implementation of these recommendations will require ongoing collaboration among community leaders, healthcare organizations, educational institutions, workforce development agencies, local government, and community residents. By working together, stakeholders can leverage existing community strengths to create sustainable improvements in health and well-being. Thank you for your time and consideration of these findings and recommendations.